Hi, in this video we're going to see some basic questions that can come from the topic blood groups. So usually what the university asks us is to write briefly about RH blood group system as well as the Bombay blood group. But in this video I'll also be covering about the ABO system because it's very important from both the Viva as well as a practical point of view. Okay. So first of all, what I mean by these blood groups? So blood groups are defined based on the antigens that are present on the RBC membrane. So on the RBC membrane we can have these antigens, and based on what antigens are present we determine what blood group they belong to, right? So the major blood group systems are ABO system as well as the RH system, whereas the minor blood group systems are P system, MN, Lewis, Kell, Kidd, Duffy as well as the Lutheran system. Okay, so there are major as well as minor blood group systems, and we are concerned mainly about the ABO and the RH system. So now we will see more about the ABO system. So ABO system mainly consists of 4 blood groups, which are group A, group B, group AB as well as group O. So of this, group A is quite common. It is around 41% prevalent and it contains A antigen, and the antibody present in plasma will be B. So suppose if this is the RBC of a blood group person, it means that he will have an antigen which is A, and the plasma will contain an antibody which is B, antibody B. Now group B individuals are far less common when compared to group A. They have the antigen B and the agglutinin present is A. So here again, if this is the RBC that belong to group B, it will contain the antigen B, but the antibody present will be A. Now group AB is far rarer and it contains both A and B antigen, and there are no agglutinin present in the plasma. So see, in this on this RBC of an AB blood group person, they'll have both A as well as B antigen, but they'll not have any antibodies. The group O individuals, they are by far the most commonest, and they will have no antigens but will have both A and B agglutinins present in their plasma. So on the RBC there won't be any antigen, but in the plasma there will be both A as well as B agglutinin. Okay, so see, these are some basic facts about the ABO blood group system. As a short note on ABO blood group system, it is important also to write about the Landsteiner's law. So what is meant by this Landsteiner's law? It was brought about by Karl Landsteiner, and it was he who said that if an agglutinogen is present on the red cell membrane of an individual, the corresponding agglutinin must be absent in the plasma. So what is this agglutinogen, agglutinin and all that? See, agglutinogen means antigen itself. You can remember it as gen, agglutinogen, antigen. Okay. So if an agglutinogen is present on the RBC membrane of an individual, then the corresponding agglutinin means the antibody, the corresponding agglutinin must be absent from the plasma. So see, that is why in the ABO system, if the antigen present is A, the agglutinin will be that of B and not of A. Okay, so that is meant by the first law. Now there is one more law. If the agglutinogen is absent in the red cells, the corresponding agglutinin must be present in the plasma. So see, if this is an RBC of A blood group person, which means he does not have any B antigen. So the antibody must be B. So if the agglutinogen or the antigen is absent in the red cells, the corresponding agglutinin must be present in the plasma. So that is about the Landsteiner's law, and it is very important to mention this when a question on ABO blood group system is asked. Next we will see about some basics about the Bombay blood group. Okay. So for that we should first know the structure of the antigen. I said it is based on this antigen that we group them into group A, B, AB or O, right? So from how was this antigen formed? This antigen is formed from a precursor substance. Okay. So from this precursor substance, if an H gene is present for an individual, it forms what is known as the H antigen. Okay. So if H gene is present, then the precursor substance will be converted to H antigen. Now, if the ABO gene is present, based on what type of ABO gene is present, then the H antigen will be converted to AB antigen, A or B antigen, whatever the blood group is. Okay. So here you can see that there are two steps in formation of this antigen. So suppose an individual does not have the H gene, what will happen? The H antigen will not be formed, right? And so naturally the AB antigen will not be formed. Okay, so when we check the blood grouping of that person, we will find that there are no A or B antigen, and we'll consider them as O blood group individuals. But unfortunately, they are not O blood group individuals. They might have anti-H antibodies in them. Okay, so such types of individuals are called Bombay blood group. Okay, it is very rare to find it because the H gene has to be recessive in order for it to be absent. But if H gene is absent, then the blood group is called Bombay blood group. Now we can also mention about the inheritance of ABO blood group system. So see, if a person has a blood group A, so his phenotype is blood group A, but his genotype can either be AA or AO. See, A here is a dominant gene, so it can either be AA or AO, and so the blood group will be A. Similarly, for B blood group person, it can be BB or BO. For AB, it can be AB only, and for O person, it can be O only. Okay, so why is this so important? This is important because it helps in especially in disputed paternity. Like for example, if the mother is A blood group and if the father is an O blood group, then the child cannot be of a B blood group, right? So this is especially important in cases of disputed paternity. So next we will see about the RH system. It was described in the rhesus monkey, and that is why it is called the RH system. So just like in ABO, we said that we have an A antigen or B antigen. In the RH system, the antigen is called the RH antigens. Especially, there are many RH antigens. It can be D, C, E. But the most immunogenic or antigenic is the D antigen. So if the D antigen is present, then we call it as RH positive. Okay, and if it is not there, we'll call it as RH negative. Okay, so here also is inherited as a dominant gene, so negative individuals are comparatively less when compared to the RH positive individuals. So now moving on to the applied aspect. What is the applied aspect, or what is the clinical importance of blood group systems? See, blood group is very important in cases of blood transfusion, because if there is any mismatch in blood transfusion, that can lead to hemolysis as well as grave complications for the patient. Okay. Next important application is it helps in preventing hemolytic disease of newborn. See, this occurs when there is an RH incompatibility between the mother and the fetus. So in order to prevent that, we should know exactly what the blood group of the mother as well as the fetus is, and in case that it is incompatible, we should take the necessary measures. Okay. Next, in case of paternity disputes, as I just now mentioned, we can know whether, to an extent, we can know if or solve any paternity disputes based on the blood group of the child. And in medical legal cases, especially if in cases of homicide and all, if we get a blood group, we can trace back whether any of the suspects have got the same blood group, right? Now for some scoring points, you can elaborate more about RH incompatibility and explain about the different forms of hemolytic disease of newborn. Okay, and you may also mention about the different hazards of blood transfusion or the complications of mismatched blood transfusion. So I hope now you're confident when you get a short note on ABO system or the RH system. I hope the concept is clear. Thank you.